Hi, I'm Bree, I'm a physio. I've been a physio for about 15 years, and I get excited when I talk loud, so just give me if I need to move my mic, because I get really excited about it. So I've been a physio for 15 years, and I've never done regular physio. I've always done pelvic floor physio. So at the start, people would talk to me about hip pain or back pain. I'd say, no, I just do vaginas. Like, I don't know what to do about your back pain or your headaches. I just do. Then, obviously, learned that you can't just do vaginas because it's attached to things that have problems too. So then I had to learn about regular physio stuff and incorporate it into physio, pelvic floor physio. So here I am. So I'm the fun one at the party when people go around the circle, oh, what do you do for a living? And I say I'm a physio, and they're like, oh, I got this shoulder problem, it hurts here. And I'm like, yeah, no, I don't do that kind of physio. And then based on how many glasses of wine I've had, then I decide, where should I go with this? So what we're going to talk today about is a little bit about pelvic floor specifically, which again, the other presenters have talked a bit about, but we'll dive into the physio aspect of it. And what can we do about pain if we have some there? So first, what is a physio? So physios are focused on movement and function in life, right? That's what we do. We look at your muscles and your joints and how they move. So pelvic floor physio just gets a little more specific. So we go into the pelvis and look at the organs and the tissues and the muscles and how they help us move and function in life. So we actually do treat men too, although again, sorry guys, we're talking about vaginas today, and kids, because a lot of problems we see, as you ladies know, that might have endometriosis or chronic constipation, a lot of these problems start when we're young, and we don't really know what normal is. So nobody talks to us a lot, pointer, until we start to have problems. So if we look back in history, when we're doing a thorough history, often again we can pick up little pieces of information from childhood and things. So we look at the bladder, what's normal and what's not normal. And normal for you, that you've always assumed is normal, might not really be so. So do you have any problems with leakage? Do you have problems with pain when you're trying to pee? How well can you empty your bladder? Does it feel like it empties? And again, discomfort anywhere in the pelvis. Bowel concerns, as has been talked about today, lots of bowel problems with pain. And we'll talk about that in a little bit too. But do you have any bowel leakage ever? Do you have trouble emptying your bowels? So is there constipation? Which we see a lot of, and again, pain. And that's the thing, I think we don't really understand what's normal for our bladder and our bowel. We don't really talk about it openly. How well do we poop and what does our poop look like? So we talk about it when you come to see me. I pull out charts and we discuss what does it look like and how often do you go? And how does it feel when you go? Because that has to be worked on. Everything's connected in our pelvis, so we have to take it all into account. So we do. Pelvic organ changes. Is there prolapse? Do you ever feel heaviness or pressure? And again, sometimes that's associated with pain. Adhesions. We've talked lots about adhesions and scar tissue today. So can I change the tissues? I can't change the tissues themselves. I can't change the scar tissue. But what I want to do is see if I can change the way your body reacts to that stuff. And again, we'll talk about that as we go. So pain concerns, again, not just pelvic, because things are attached. So any hip problems, back problems, SI joint, we look at all of that from a physio perspective. So what is the pelvic floor? Everybody teases me because my other pelvis comes with me wherever I go. And usually it falls apart. I work at City Hospital as well with pelvic floor problems, and because it falls apart all the time, I send it to maintenance. And I think the maintenance guys look at it and get a little frightened, so they put double-sided Velcro to hold it together. So if it falls out, that's okay, we'll talk about prolapse then. So the pelvic floor is a group of muscles that sit within our pelvis. So they serve a purpose to help support things. They should give us closing pressure to keep us dry, keep things contained. The big thing with pain is then they need to recognize they can let go again and relax. That's a big problem because when muscles hurt, they guard. They don't want to let go. They don't know how to let go. So even though they all work as a team, all of these muscles, we should be able to focus on certain areas a little bit differently. So if I don't want to pee, if I cough or sneeze, I need to focus a little more at the front because that's where I might leak from. For my bowels, we need to work a little bit more at the back. So we can help kind of focus on different areas if we need to, but they need to work as a team, so then we have to integrate them and coordinate them again, which we will talk about. So here's our pelvic floor layers. So this is kind of the outside layer. Oh, I've been doing this for 15 years and I still giggle sometimes and I think, is this really what I'm talking about right now? But I do and it's fun, so let's go with it. Okay, so lots of different layers to tissues, and do I look at each layer separately? No, from my perspective I can't. I don't get in there like the docs do and look at different layers. but I can feel the way the muscles work. So I want nice strong contraction. Like I said, I need a nice release when I want it to relax. So, because everything's connected, it's never just about that little diamond-shaped pattern. It's also about everything that connects together with it. So then we look at lower abdominals. My lower abdominal muscles and my pelvic floor should work as a team together. They should contract together, they should relax. They forget to do that sometimes when there's pain involved. Also my glutes. Our glutes are our big drivers. And ladies, we're a society of flat-bummed women. We need to get the glutes going. So I always train all these core muscles with our pelvic floor. I'll look at the inner thighs, I'll look at the spine muscles. When there's pain involved, whether it's in my back or in my hip or in my knee, it's going to throw off the mechanics of the body. So we have to get everything back as a team working together again. So we need to move, and then we need to move for life. And life might involve lifting kids, lifting groceries, lifting laundry, doing sports, being in a job where you're on your feet a lot. So we have to take that into consideration. It's never just about, can you lay on my bed and show me you can do a Kegel? That's useless. That has nothing to do with life, right? So okay, we start there. Then we have to get on with life. So here's some pictures of the other muscles that are attaching in and around our pelvis. So you can see there's spinal muscles, there's hip muscles, there's glutes, there's hamstrings that are all attaching up around the pelvis. So we have to take them into account and get them training and firing with my pelvic floor, or your pelvic floor, mind you. It's a group effort. So these muscles react. So they should react to physical stress or pressure, to pain, naturally they do, and to emotional pressure or stresses as well. So when they're anticipating this, normally, when they're anticipating that I'm going to cough or sneeze or jump or do something, they should contract and help support me. That's normal. They should do that. When we're 16, we don't have to think about, oh, I'm going to sneeze, let's not pee. They just do it on their own. Lucky for us. Then, after they've tightened, they need to let go again, right? Because our pelvic floor, our vagina shouldn't be up around our ears. That's not normal. So there's no such thing as thinking about having your pelvic floor tight all day long. Tight isn't useful. Tight is tight. A tight pelvic floor, once you get it to relax, is usually very weak because it's been tight for so long that it hasn't been working. So once you let it go, there's nothing there. We have to rebalance it. So after they're done their contraction, they need to come back down and release. Sometimes they forget to do that. They spin themselves into a pattern and don't know that there's any other option. So, like I said, the contraction keeps us dry. It prepares us for movement. So if you're looking at an ultrasound of the pelvic floor and somebody's going to scare me and I jump, which I do a lot. I'm a little type A, as you notice. If I'm going to jump, my pelvic floor is the first thing to fire before I actually jump because that's what keeps us dry and supported, right? So it needs to anticipate that we're going to do something. But sometimes we have to reteach it to anticipate things properly. It's going to prepare us for movement or activity. If I'm going to do a jumping jack, I shouldn't have to think about my vagina first. I just want to jump. It guards us from pain or stress. Any muscle in our body does this, right? If we have pain, it hurts, so we protect it. That's what keeps us safe until it heals. That's a good thing in the short term. Orgasm. Okay, because this is the thing about our pelvic floor. We have sex. And it needs to help us do that. And it should be comfortable, and it should be fun, and it should not be painful. So these muscles need to learn with orgasm, with sex, with movement, that they can help us do that, but then they can relax to let go after. Because we don't want to feel this 24/7. This doesn't feel good long term. So it should contract properly and with control, then it should let go. Oh, here's why we need to let go. So we need to let go to pee. We need to let go so we can poop, right? We need to let go so things can come in and out of us. With a lot of pelvic floor pain or a pelvic floor spasm, often it's hard to empty our bladder fully or our bowels because our pelvic floor has gotten so tight and so protective that it doesn't recognize that it can let go to let things come out of us as well. So again, when we take our history, we ask a lot of questions about that. How does it feel to have a bowel movement, or how does it feel to pee? Because it needs to learn to do that. So if these are not happening automatically, the contract and relax cycle, we have to teach it how to do that again. So can I change the source of the pain with this? No, I can't change that there might be adhesions or a disc bulge or something like that by doing pelvic floor training. But what we can do is teach these muscles to come under control so that we can respond in a different way. So I always say our vagina shouldn't be, sorry guys, that's what I talk about. it shouldn't be an open cavern where things just come and go in and out of it, right? Like it's okay that it kind of goes, whoa, maybe slow down, but then it needs to relax and let things empty or let things in or out, right? Just had one of those thoughts again. Good. Okay, so again, this is looking down in from the inside of all that big area of muscle. Tons of muscles, right? So do I look at each little itty bitty muscle? God, no, we'd be here forever. But we need to teach them to work equally as a team. There's no point being really strong in one area, like traditional Kegels tell us to do, right? So Kegels are to make our vaginas nice and perky after we have babies. They're right in the middle, around the vagina. That's that little bit in the middle. Like there's still all that other muscle that we have to pull in. So we have to look at the back end, we have to look at the front end, and teach them to work as a unit. Getting excited, I'm talking too fast. So how does pain affect us? So we kind of talked about this a little bit already. So we have tightness and spasm because when things hurt, they don't want to work. So they're going to guard themselves. That's how we heal, right? We just shouldn't have to heal for 10 years with our vagina around our ears. So there's often inflammation, and then there's guarding, not just from that muscle that hurts, but from everything else that's around it. So lots of times it's not just about your pelvic floor. It's about maybe your psoas or some deep abdominal muscles or your back muscles. Your glutes get pulled in, right? So we have to look at all of that. So in the short term, it's okay that our body protects us. That's a good thing. But overall, then, if it stays tight and ineffective, it's going to continue to get more weak, more sensitive, and we'll get more problems from it. Oh, my slides is missing. Okay, so pretend, if you will, pelvic floor specifically. So we kind of talked about the bladder and bowel and all that kind of stuff. When you come in, I ask you about your bladder. So how much do you drink in a day? How much caffeine do you take in? How well do you feel like you empty? Are you up at night to pee? Because if you're up 6 times a night to pee, you're not sleeping either. And we talked about sleep earlier, right? And how important that is. We'll talk about your bowels. How much fiber do you get? How much water do you get? How much do you move? And how easy is it for you to empty your bowels? Do you have pain when you have bowel movements? Hemorrhoids, bleeding, any of that kind of stuff. We'll talk about your birthing history. So how many pregnancies? And how did the births go? Sometimes babies are fun to make. Sometimes they're not so fun getting them out. So if there's forceps or suction involved or stitches, we have to look at that and take that into account. Menstrual cycles. So we've talked lots about hormones today and the fluctuations and how they affect us. So what for you is your cycle like? It's not about normals when I talk to you, it's about you, right? We've all talked about that today, how individualized this is. So for you, what is your cycle like and how does that affect your pain? We'll look at, we've talked about diet a little bit, but other intolerances that you may have, because lots of women find, like we talked about, that gluten or dairy will really affect their system. So we'll go through all that kind of stuff. Other injuries or illnesses. So whether it's a specific hip problem that you've had, or a back problem, or fibromyalgia, or MS, or any of that other kind of stuff, is all going to affect your pelvic floor. We'll go over work and activity levels. So not just how much are you on your feet and how much lifting you do, because my little pelvic floor has to help me do that long term. But then if I do add in more activity, or if I am doing one of my daily tasks, how does that affect your pain? So can you go to Costco and then clean your house? Or is it that you can barely get to the mailbox and then you have to go back home and lay down the rest of the day? And again, for some women, it's completely random. And that's the tricky part at the start, right? Is can we draw any kind of consistencies and follow it? So Dr. Teal and I were just talking about this before we started this session, was social impacts of this, right? It's never just that you hurt in your vagina. It's that it affects your work, it affects your relationships, it affects how we can live our life. So we talk about that. And we find you resources to help you with that, because it's never just about that muscle. It's about how everything interacts. Sleep, we talked about stress levels. We're, as Dr. Letter said earlier, we're women, we're a bit type A in general, we want to get things done. I always say we're women and we're pretty good at trying to keep everything on an even keel if we can, which means we tend to internalize a lot, we tend to store things in our side of our body. So we know that stress affects our body, we know that we get tight and sore muscles. Our pelvis is no different, it's going to get pulled into that. So, once we figured out kind of what's happening, then we have to figure out how to treat it. So the first thing I always start with, because I'm a pelvic floor physio, is I look at your pelvic floor. So I do an internal exam. So, like any other muscle in our body, how strong is it and how well does it relax? So, to do that, I need to know not your reactive strength, because you ladies with pain, you're strong, but it's not controlled strength, right? It's spasm, it's reactive strength. So when I have you squeeze, everybody can lock down on me if they need to. That's not the point. It's can you gently squeeze and then can you gently relax it, right? We are so used to on and off and on and off. That's not life. I get excited and I talk too much. Life is about, can we maybe just squeeze a little bit and then can we let it go? So we have to work on that. We have to work on a controlled pelvic floor and get rid of that reactive or spastic pelvic floor. If there's other issues, hip issues, back issues, that kind of thing, I love working with chiropractors, orthopedic physios, acupuncturists, whatever we need to. It's never just about me solving problems. I love working with the team. If we need to work on stretching muscles that are tight, I will help you do that. So I can do internal release techniques. I can guide you to some tools, I will say, that you can use at home as well. That's a whole other talk. The big thing is often with pelvic pain, sex is painful. Wearing tampons is painful. So if that's an issue, we need to add that in again. And it's baby steps. It's about teaching our brain that touch is okay, and pressure is okay, and friction is okay. Because, as we talked about earlier, anything that's perceived as a threat will cause these muscles to go into spasm. And threat might be something as simple as bending over or squatting down. It's not that you're going for a 10K run. So we have to teach these muscles to feel things in a different way. So we start with the basics. We have most of you have been to physio, probably. Physios are notorious for giving you 8 exercises that you're supposed to do 4 times a day and do 3 sets of 10 reps and take your mat to work and your block to work. Nobody can do that, right? And again, with a system that's a bit sensitized, you don't need that. So I give you 2 exercise max when you come to see me. I give you 1 for your pelvic floor, and I might give you 1 stretch or 1 really gentle, super simple core exercise, just to reintegrate things, and then we go from there. So we've kind of talked about the hormone stuff. Like I say, I start with pelvic floor specifically, then we have to add in life movements to it. So I increase your core strength. If we need to look at sport training, if you're wanting to get back to a sport, we can do that. Once I know that you can get through a day, maybe lifting your groceries and carrying them into the house, then we'll look at going into more specific sport activity. But there's no point in me giving you a handout with 6 exercises and saying, off you go. Again, we have to change the way your brain is interpreting things, right? So I give you 2 exercises. I might not see you for 2 or 3 weeks because I need you to go off. I need you to connect with your body and feel things. And then you come back and see me. And then maybe I give you 1 new one. It's not about attacking your system. It's about teaching your system to settle, and then we rebuild it, right? So life is about moving. We have to move. But we need to teach your body that movement is okay. We need to trust our bodies again, and we need to have faith in them. Because a lot of times with pain, we don't like our bodies. So we need to reconnect to them. We need to add movement back in generally and gradually. So, like I say, if I need to, I can do more hip or core exercise training. Flare-ups are going to happen probably, right? I'm giving you new things to try. It's okay that you flare up. We just need to make sure that your flare-ups are shorter, gentler than they used to be. Your body is not going to love this new way of change. It's used to this. It doesn't know any other way. So it's going to react. But it doesn't mean we're going to send you into a flare-up that you had in the past. No body is the same as the next. So again, we've talked about this, right? Everybody gets their individual exercises. I don't have a sheet, you guys that know me here. Thank you for coming. You know that I don't just photocopy something and hand it out. For each of you, when you come in, I sit down and I handwrite stuff out because everybody is different. We don't know our bodies until we try. We don't know our limits until we try something new. So I don't push the limits, but we nudge up against those boundaries a bit and push them down the road. Whew, I got her done. Okay. Thank you. So at coffee break, we're all going to come back up to answer questions if there's any.